thank God for another day. Thank God for this virtual meeting. It's a training actually where we'll have experts from the EOC coming to train us, because as journalists, we come in contact with different people every day, and we are at risk, liable to catch, the virus, because we have guests coming to the studios, we go out to do interviews, we meet with people, we have to go out to a few programs, even though we do not have a lot of crowd, but you do not know who you meet on a daily basis. So our executive president thought it fit that we should have a meeting, and we partner with the EOC for this. Welcome everybody who's on board. We would have 2 trainers. We would have Jamiru. Solomon Jamiru is the spokesperson for the EOC, and Harold Thomas. Harold Thomas is the risk communication lead. But first, let me say hello to my executive producer, my executive president. Sorry, madam. I'm sure you'll have a word or 2 of introduction before we continue the training. Over to you, my lady.
Thank you very much, Lady Patricia Ganda. I am very pleased to have the EOC, now the National COVID-19 Emergency Response Center, to honor our request to give us this training as female journalists. Like I said, the last Zoom meeting with colleagues across the country who gave us their views reporting COVID-19 from the front lines. And they explained to us the issues they are facing reporting, on the front lines. So we thought it fit to come up with this training when they will have knowledge to go out there in the field to report on the coronavirus. So they will not be scared as female journalists to say, no, we are exposed to dangers out there, we can't go. But if they know how to navigate their way through the prevention and control measures they should take, I think it's very good for us. I know we're a little bit constrained because of the weather today, but we have our colleagues who are trying to connect from across the country, even in the regions, to be part of this training. So I am really, really happy, and I'm pleased that the National COVID-19 Emergency Response Center honored our request, and we're looking forward to more partnership with you because our membership is across the country, and we're also very viable in the fight against the coronavirus. With time, we'll also allow our ladies to ask questions and share some of their experiences, but that will be after your presentation. Thank you so much for allowing me to talk, Lady P. Over to you.
Thank you very much, Madam Executive President, and you're also my executive producer. So I have the right to call my executive producer for this program. Well, we'll start, and the other ladies will join us as we go on. I am Patricia Ganda. Mr. Jamiru, welcome to this edition of training. We are studying women, Association of Women in Journalism. Mr. Jamiru, how are you?
Thank you very much. It's a pleasure to join you, Sierra Leone Association of Women in Journalism. We believe that this is perhaps the first step in a very fruitful partnership. I'm sure that we will continue to interact more, not only with ourselves, but with the critical issues revolving around COVID-19. And on our part, we just wish that Harold will take you through a few slides. And after that, I'm sure we should be able to have an interaction on this, and we'll be willing to respond to questions, comments, so that at the end of the day, we would continue to have a better appreciation of what this COVID is all about and what are the critical steps that NACOVAC is taking. And we believe that you would complement the work that we do. Because for us in risk communication and social mobilization, especially for risk communication, our very important and primordial principle is engaging communities and building trust. So I believe that women in journalism would be able to support us in not only widening and deepening public education around COVID, but to see how we could continue to build on public trust and engaging communities, because for us, it's never enough just disseminating the message. It's never enough to understand the message unless we have the ultimate objective to change people's behavior. I am not sure we have really done enough. So you guys standing by us and helping us not only to engage community, but to build consolidate trust. So Harold will take you through a few slides, and after that, would be very pleased to interact with the issue.
Thank you very much, Mr. Jamiru, and that's how welcome Mr. Harold Thomas. He is the risk communication lead. Mr. Thomas, you're welcome, and we give you all our attention. We want to learn as much as we can from you.
Okay, thank you very much. As Mr. Jamiru has said, we are very, very pleased to interact with you and to share our. This is going to be an interactive session. Not as learning from you. I would want to ask that you give us access so that we can share on the screen. I'm asking the host to give us access so that we can share a screen for the presentation, please.
Okay, well, we're doing that now. To give you access, I think we're seeing you. Madam Executive President, please.
We want to share a screen for listening. Okay. Thank you. Okay, go to slide two. Okay, can you see the presentation on the screen, please? Hello? Hello?
Yes, hello, we are getting you.
Yes.
Can you read from the screen?
Now.
We are getting
Yes.
Okay.
Yes, we can read.
Okay,
We can see the presentation on the screen.
Okay, I will take you through this slide, and then later Mr. Jamiru will post the update for today. What is coronavirus disease? Coronavirus disease is transmitted from person to person. It's a respiratory illness, and it can spread from person to person. Okay. The virus that causes COVID-19 probably emerged from the animal world. We have this is what we call a zoonotic disease. It can affect animals, and then it can affect humans at the same time. And when it comes to human world, then we have what we call sustained human-to-human transmission, and that is what we're doing on now. So it's spread by close contact. That is why it's important for us to have what we call physical distance. That is, we should be apart from each other, like, and it is spread by what we call droplets. That is from coughs and sneezing, and even when you speak or when you breathe. It is also spread by touching surfaces or objects, for instance, counters, rails, tables, doorknobs, etc. And if you touch an infected surface and then you touch your eyes, your mouth, your nose, or your ear, then you are at risk of getting COVID. Let's go. Let us look at the signs and symptoms. When we say sign, it's what you see from someone as a patient, and symptoms is what the patient feels. So this is subjective. The symptoms is what you feel, and then the signs is what you can see. So we have fever, cough, and also the patient can sneeze, and then tiredness. And in some instances, we have what we call difficult breathing or shortness of breath. And as a complication in advanced stages, in some patients will have pneumonia or problems or inflammation of the lungs. And then it can affect other organs like the heart, the kidney, the skin, the liver. So it can also lead to multiple organ failure, which results in death. Now for the preventive measure, it's simple: wash hands with soap and water, or you can use alcohol-based hand rub of 60% and above. You can, for the Muslim, if you are doing ablution, it's important for you to wash your hands with soap before you perform ablution. Also, you stand 1 meter apart from each other, that is 3 feet at arm's length. When you stretch your arm, if the other person next to you stretches his arm, you should not touch each other. So 1 meter or 3 feet, that's the distance that it takes. But it's safer when it's above 3 feet or 1 meter. Avoid crowd or mass gathering. That is what we call social distancing. And you also avoid touching nose, eyes, and mouth with unclean hands. And avoid non-contact greeting, like shaking of the hands or touching. If you are sick, it's important to stay at home, and then you can call 117. You cover your mouth, you cover your cough or your sneeze with a tissue, or you can also use the back of your elbow to cough or to sneeze. Clean and disinfect frequently touched objects and surfaces, like I indicated earlier, like the doorknobs, rails, tables, counters, or any surface. You ensure physical distancing. That is, you should not be close to each other, at least 3 feet or 1 meter apart. If you observe signs and symptoms, that is fever, if you are coughing or sneezing, or if you are extremely tired, or you have difficulty in breathing, it's important for you to call the toll-free line, which is 117. And for those in the regions, they can also call local authorities if they suspect any new visitors coming into the community. Now, how can you protect yourself? It's important that people protect themselves from respiratory illness through everyday action. What you do every day is very important for prevention. Avoid close contact with people who are sick. Avoid touching your eyes, nose, mouth with unwashed hands. This, I am afraid, is the third time I've highlighted this, but repetition also emphasizes the point. Wash your hands often with soap and water for at least 20 seconds. And you can use an alcohol-based hand rub, which contains 60% alcohol or even higher. Okay. Now, it is important to note that there is no vaccine for COVID as yet. So currently, because there is no vaccine to protect you against COVID, the only way out is prevention, prevention, and prevention. So this is where I end my presentation, and I will pause and then, okay. Let's go. Okay, I have a few slides again. Go. Next. Next slide. Okay. Well, these ones, these are messages actually that we captured for when in instances when we have this lockdown of coffee, so that people can understand. Let's go. And these are some of these messages. You know, the virus, the coronavirus, does not move by itself. It is moved along by people. So if we limit movement, it's important for preventive purposes. And to change working hours, also, it gives time to move to and from home whilst obeying the curfew. So that is very important. That is why the working hours have been adjusted. And stay home as much as possible and limit your time out in public places. This is very, very important, as I said. The COVID virus does not move. It is moved along with people or by people. If you and your family member has fever, tiredness, or cough, it's important that you call 117. And the hand washing, the physical distancing, the cough and sneeze etiquette, and early health-seeking behaviors, these are also very, very much important in preventing COVID. So thank you very much. This is where I end my presentation. And if there are questions so far, we can address the questions, and then we'll go on to the updates for today.
Okay.
Thank you very much, Mr. Harold. That was so brilliant. There are so many things here. I myself, my eyes were opened, like you talking about the disease, us contacting it from surfaces. You know, some time back, I had to go to an office. The office was on the 4th floor. And on every floor, there was this bucket to wash hands. And I was like, but I washed my hands downstairs. I have to wash my hands on every floor before I get to the 4th floor. That I said to myself, but I washed my hands and went to do what I was doing. But now I understand that you could walk through the stairs, touch the staircase, and you could still contact the virus. Thank you so much for that. Ladies, do we have questions? The floor is open for questions. You could ask questions, please.
Patricia, before the questions, may you please oblige me give you the statistics for today?
Yes, Mr. Jamiru, you're welcome. Please go ahead and give us some statistics.
Thank you very much. So for status update for 30th May, cumulative confirmed positive cases, 852. Total number of deaths, 46. Active new cases, 23. Active cases at isolation centers, 391. Cumulative recoveries, 415. Number currently quarantined from quarantine, 3,830. For our active new cases, the 23 cases in the last 24 hours, we have 6 from West and Urban, 8 from Cont district, 1 from Koinadugu district, 7 from Kenima district, and 1 from Silao district. So if you look at the cumulative recoveries against the active cases isolation centers, We believe that Sierra Leone is making a steady progress, thanks to the sacrifices of our healthcare professionals. I also just wish to note that when we recorded our index case end of March, we only had one city in the whole country, which was at 34 military hospitals. Today, we are proud to note that we have 4 treatment centers in the Western area, and 8 treatment centers, including Potloko district, Bombali district, district, Kailao district, Moyamba district, Kono district, Kujaun district, and Kambia district. It is the intention of NACOVAC that we have a treatment center in every district. We also have 3 community care centers where we accommodate mild and asymptomatic cases. For example, we have at Frobe College in the Western area, we have the PMTC at Hastings, and we have one in Bond. So we'll continue to take the appropriate steps. For the last 24 hours, we did 226 samples. 226 samples were obtained in the last 24 hours. And when they were analyzed, we had 23 positive cases. The total or the cumulative tests that we have done nationwide is 6,299. 6,299 represents the cumulative tests that we have done nationwide. So that is just an idea of the statistics, and I thought it's important that I also furnish you with these ones, and I'm sure that may inform further questions or comments from you. Thank you, Patricia.
We know that the cases are dwindling. Is it that the tests are not being done? We do not have a lot of tests being done, or is it that the numbers, the same number of tests are being done daily, but then the number of positive cases are dwindling? What is the cause of the number of positive cases dwindling, Mr. Jamiru?
Thank you. Can we agree on an approach? Which option would we prefer? That we respond to every question, or we take an aggregation of questions and we respond? Which option would you prefer?
Well, let's take like 5 questions, and then you would respond.
Thank you, Pat. Thank you.
Ladies, questions, please.
Hello?
Yes, go ahead with your question, your name and the question, please.
Okay, I am Amina Safina Masakoi. 2 things that I want NACOVAC to help to advise us about. Firstly, we know TV journalists, they have tripod when they go to do interviews. So the distancing can be observed very easily, TV journalists. But now, what about us, the radio journalists? We walk around with recorders, and even for the newspaper journalists. With your recorder, you need to go very close. What is the advice? What do they advise? What are the proper use of recorders? The recorders that we use to do interviews. What should be the proper use of these recorders? And secondly, we've now seen that Western area is the epicenter, has become the epicenter in the fight against the COVID-19. How are they intending to make sure that Western area is properly controlled to reduce the transmission of this virus?
Thank you very much, my eminent lady from Masakoi. 2 more questions, please, before we throw the mic back to Mr. Jamiru or Mr. Thomas to respond to our questions.
Yeah. Yes, Madam Moderator.
Yes, go ahead. Your name and the question, please.
Hi, I'm Maria
All
Makai.
right. My name is
I want to say a very big
Jamiru.
thank you to our presenters this afternoon. It was a wonderful presentation. I learned a lot. We've been hearing, but something new came up that I do appreciate, especially with that of the ablution before you take it. You should ensure you wash your hand with soap. I wasn't thinking of that, so thank you so much. I'm just concerned in my area. We have a group of crazy boys, frisky boys, that normally pass on this information that if you take alcohol, especially our locally produced apetition, if you take it, it will kill the virus. I want you to help me with this and how or which message will I pass on to them so that they understand better. Because from your presentation, for now, there is no medicine for the virus. So if they are passing around with this kind of information, we need to find a way to dispel this myth that they have. Another thing again is also with the traditional method of treating COVID. So many people or videos are circulating around that COVID can be treated through steaming. If you collect different herbs, boil it, and cover yourself with it, it will help take the virus away. I also want you to help us. What actual message should we pass to them so that they will know that this is not the method, or probably this method can help? That's what I have for now. Thank you.
All right.
Thank you very much, my eminent lady Kaifana. Let me turn over the mic to Mr. Jamiru and Mr. Thomas. We have 5 questions. Could you respond to those questions, please?
Okay. I would let me say. Let me first speak to the figures that seem to be dwindling. That is our general observation as well at NACOVAX, the National COVID-19 Emergency Response Center. But considering the nature of the disease and the epidemiology of this disease, you usually have to wait and see. If there is nothing else to learn about COVID, one of the things that I have learned is that you don't jump into conclusion, because you just wouldn't know the next dimension that the virus will assume. In trying to explain how the curve operates, the epidemiological curve, how it operates, we always love to talk about it by establishing a clear distinction between what is known as a propagated outbreak and a point source outbreak. In a point source outbreak, let's say, for example, 75 people attended a party and there was food poisoning, or there was food poisoning in a certain village that has 75 people. You are most likely in a position to determine the period of exposure and determine how the curve will operate over a given period of time, because it's what is called a point source outbreak. You can predict the trends and patterns of the curve. But for COVID-19, which is an example of what we call a propagated outbreak, it is difficult to predict the curve. So for example, when do you attain your peak? And when do you start bending the curve? It is difficult to explain it. An outbreak or an epidemic, or you call it a pandemic, when it's a propagated outbreak. And this is exactly what we are dealing with. So that is why when people ask, when is Sierra Leone attaining the peak? When are we likely to bend the curve? That is the difficulty that we have. That for COVID-19, which is an example of a propagated outbreak, you are bound to see different fluctuations in the curve as you move along. And that also explains why you don't just start comparing where Sierra Leone is in the fight against COVID-19 with that of where Guinea is, where Liberia is, where Ghana is, where the United States of America is. Because COVID-19 is not like a 100, it's not like a 100 meters race where you know how you all started and how you are all most likely to finish. Every country is at a unique point in the epidemiological curve. The point where Sierra Leone is different from the point where Ghana is in the curve. It is different from where Uganda is in the curve, because every country has its own unique facts and circumstances about this disease. Every country has its own methods of addressing the disease, dealing with the infections, slowing the spread of the transmission, and eventually stopping the spread of the transmission. In some countries, for example, they only test people who are severely sick, who go to the hospital. In Sierra Leone, when we have a positive case, we categorize all the primary contacts, and after 14 days, we test them. When we had people from Kuwait, for example, we did not wait until 14 days to test them. We tested them on day 1 of the quarantine, and we were surprised at the results that we had. So every country has its own unique ways that it is approaching the disease. So when we compare, we have to be careful because we are all not at the same point in the curve, and we all employ different means to address COVID-19. So when we look at the figures coming down, we are not quick to conclude that, okay, we are beginning to see, for example, the end of coronavirus. Because sometimes when you start thinking like that, perhaps the following day of what you do, you might start experiencing a spike or a surge in the figures. Sometimes if you are not careful, you would want to say, okay, with the figures that I'm beginning to see in the Western area, let us open up. Let us start easing restrictions for interdistrict. That is the mistake some countries have done. Senegal suffered it recently. Once they eased restrictions, they saw a sudden spike in the figures. Ghana, United States of America, Texas suffered it recently. So we might see the figures bringing down, and I agree with you, because when we looked at the Western area figures, last week alone, we saw how the numbers were rising. 2 weeks, 3 weeks ago, 4 weeks ago, Western area was giving us a lot of figures. Now those figures seem to be reducing, and we don't seem to have any statistical difference, really. Very encouraging signs for us fighting COVID-19, but also very early days to start thinking that these are signs that we are already bending the curve in the Western area. That is one. The second one is on alcohol. You know, all of what we are doing in fighting coronavirus, we are doing it based on the expert advice and the guidelines that we have generally from the scientific community, but specifically from the World Health Organization, the Africa Center for Disease Control, the West Africa Health Organization, and for Sierra Leone, the Ministry of Health, the scientific and technical advisory team that President Bio set up, and also the experts at NACOVAC, the National COVID-19 Emergency Response Center. So when we advise people, for example, on what drugs to take, what are the things that we use as therapeutic cure, we want to make sure we don't advise out of those expert guidelines. So for example, it is not yet proven that alcohol can kill the virus. Recently, we had drugs from Madagascar, the Madagascar COVID-19 organics. President Rajolini in Madagascar is saying that this drug can cure coronavirus. I also saw one of the music stars in Madagascar testifying that that was the drug that cured her in a treatment center. But World Health Organization, African Center for Disease Control, West Africa Health Organization, and even here, our scientific community is saying, don't use it until there is an established clinical result from the trial that it is something that you can use. Even the literature that Madagascar sent to us, little or nothing is contained in the literature, even for our clinicians to make a determination on whether or not we can use it. When Madagascar asked South Africa to help in conducting a research on the COVID organic, South Africa was very cautious to say to the Madagascans, okay, we can do a research, we can assist you, but our assistance is not to go into clinical research. We can look at other materials. When Madagascar said that this thing can cure, we know that there is an artemisinin from the Artemisia plant. But they are telling us that other things are contained in the Madagascar organic, but they are not telling us which other things are contained in that Madagascar organic. So we really have to be careful what we say to people. So people who say that alcohol can treat this, there is no clinical evidence that alcohol can cure it, and so we cannot advise our people to use it. As far as we are aware, the United Nations announced recently that they have over 70 vaccine development programs on their database. But they only believe perhaps not more than 10 of those 70 vaccine programs would be successful. America is pumping billions of dollars to find a vaccine. America is supporting, for example, Oxford University to come up with a vaccine. Other clinical trials are taking place until the scientific experts say to us, this cure has been tried, it has been tested, it is something that is fit for use. We cannot advise anybody to take any drug as a potential cure for COVID-19. Let me ask Harold to speak to some of the issues.
Okay, thank you very much. Now we also on the question of alcohol to cure or as a remedy for COVID. I think that is what I understand by your question. Alcohol can kill. Alcohol 60% and above can kill coronavirus. That is, you can use it as an hand rub or to clean surfaces. But to drink alcohol is very, very dangerous because when you drink alcohol, your immune system is compromised. So you stand a chance of even dying from coronavirus if you have it. So it is not advisable to take alcohol, as a remedy for coronavirus because it can what we call compromise your immune system. So that is a misconception altogether, and it's very, very dangerous. It should not be encouraged by any youth or anybody to drink alcohol as a remedy for coronavirus. Again, on the numbers that are going, that seems to be going down, as Mr. Jamiru has explained. These numbers, if they come consistently, and if we are doing the same number of tests, it would suggest that we are getting to what we call a plateau. That is like, almost the same numbers, because if you have 14 consistently, 15, 20, 18, 21, these numbers, they are not statistically significant because there is no statistical significant difference between, for instance, 15 and 18 or 14 and 15. So but if it comes consistently, then it would actually mean that if everything being equal, we are coming to like a plateau, like a steady, numbers that and it can grow. But in epidemics, we can have peaks, and then we can also have what we call multiple peaks. It can drop and it can rise up, depending on the situation, as he was saying about the point source and propagated source. And also common sources also in epidemics, we can also have common source. If you have an infection, for instance, from one particular source within, for instance, like a quarantine home, that would give rise to a number of people being infected at a particular point in time. But as we say, we should have, consistent, data. We should have consistent data so that we can make decisions. And our intervention should also be consistent before we make any judgment. And looking at Western area as the epicenter, it is very high. And if we compare Western area to other districts also, we should be mindful to even say that there are a lot of cases in Western area than other districts, because we are looking at it in terms of percentages and not in terms of absolute numbers. For instance, if you have 50 cases, for instance, in a population of 100 population, that is 50% for easy calculation. But if you have in a population of 20, and then you have, for instance, 15 is lesser than 50, but in a population of 20, if you have 15, that is, there are more cases, in terms of percentage in that population than for the population of 100. So we look at also in terms of percentage. Western area has the largest, greater population than other districts. So we should also be mindful how we, compare these trends. So we look at it in terms of percentages and also thresholds that are set, and also in terms of denominator. So, but it is easier to say that if you look at it in absolute numbers. And that is why the bulk of the population is in Western area, and that is why we have, started a campaign, the Stop Corona campaign that we have started in Western area about a week ago, and we will continue until the end of this coming week. And then we will also make sure that we upscale to other districts, because Western area has the greatest population and people are not actually practicing what we are telling them. They know that for the knowledge, they have the knowledge because from other surveys that we have done, other studies, we know that the knowledge in coronavirus is very, very high, the knowledge base. But the attitudes and the practices, this is another phenomenon to deal with. So what we are doing is we are trying to make sure that we influence attitudes. For instance, for the use of masks, social distancing, early healthcare seeking behaviors, and also cough and sneeze etiquette. And for masks in general, for Western area, it appears that people do not want to use masks in spite of all our interventions. So that is why we are, doing this campaign in the Western area, urban and rural, and then scale up. Because if we are to ease other restrictions like inter-district lockdowns or curfew, if social distancing is practiced, and if the use of masks is also practiced with other measures, then we are sure that we will reduce the new infections of COVID-19, and these restrictions can be relaxed. So this is another point. And then we also, someone was asking about, I think, what is it? Okay.
The mic, journalist.
Okay, the mic, yes. Yes, for the microphone, these are objects and they are referred to as formats. They can actually spread in cases of COVID. That is why it is important to be very mindful for the journalists and even those that were the people that we are interviewing, the interviewers and the interviewees should also make sure that they have safe distance when you are doing your interview, and you should be masked up. Use mask, and then the physical distancing is overly important, because if you come so close to put your mic, for interview, you may be putting yourself or the interviewee at risk. So it is very, very important to be very mindful. That is why, for now, it's preferable to do like an online interview through phone or through other means like Zoom or other virtual means than physical, because we are putting people at risk. These mics are formats, they can actually harbor the virus, and it can be spread if we are not very, very careful. So it is not advisable. Even to do most of these programs, even radio and television programs at the studio, it is important for us to, as best as possible, to be doing virtual interviews or virtual programs, because you cannot guarantee the safety of yourself or even your studio guests that you are. That is the reality. So the closer you are, the more vulnerable you are. So it's important for us at this stage to be practicing like virtual interactions rather than physical interactions. I don't know whether I've left anything.
And Mr. Thomas, we have one more question. The last question that Lady Kaifona asked about steaming. Like, I think she was talking about people in the villages who believe they could smoke themselves, boil some herbs and cover themselves, smoke themselves. Yes.
Yes, everything we are doing, it should be evidence-based. There is no evidence to show that these remedies work. Even if they work, they are not proven. So what we know are things that we are proving scientifically. So we will always, update people as as events unfold, as we have proper evidence. But these are important things like like herbs and other remedies. People say they work, but for us, we will not validate them as long as there is no scientific evidence to prove. That is what I would say for now.
And I just wish to add, based on what Aaron has said. Honestly, Patricia, I believe that given the calamity, I think it presents us also a lot of opportunities for innovation. It presents us a lot of opportunities to showcase. If Madagascar will start talking about COVID organics, I see no reason why no other African country should be looking inward to see what it should be willing to showcase as well. It may be possible that, yes, some persons may have, even for us, all of us connected now on Zoom, it is possible that we contracted coronavirus sometime and we are all recovered from it without even knowing it. It is possible. So it is possible that somewhere in the villages, somebody somewhere may have gotten it and perhaps received cure one way or the other. But because we are talking about science and we know how science works, science is evidence-based. If you tell World Health Organization that, look, the gbangba in Sierra Leone can cure COVID, what they would want to do is to subject all of that to clinical trial. They have to make sure that they go through the experiment, because they will tell you that under normal circumstances, it takes between 12 to 18 months to have a vaccine. So which means they would have to subject that to that. But it does not really mean that it is impossible for anybody to have a cure. But just that when people say they could smoke themselves and this, it does not really have any scientific basis at this time.
Okay.
And thank you very much, Mr. Thomas. Let me go back to my colleagues. Do you have more questions, ladies? The floor is open. Please introduce yourself and go on with your question. Thank you. If you are just joining us, this is a training by the Sierra Leone Association of Women in Journalism, and we have partnered with the EOC. Yes, please go on with your question. Go ahead, my lady.
Yes, Patricia.
Okay.
Yes, go ahead, please.
Patricia. Hello, Patricia.
Yes, go ahead with your question. Yes.
Margaret Mansaye from Radio Dinsman in Akabala.
Okay.
Waiting I go on for no now with regards to this area of the mic. Like if we do not get anything where we go use that for somebody don't come out to studio for disinfectant.
Okay. Thank you very much, Lady Margaret. I'm sure they would answer your question in a bit. Any other question, ladies? Go ahead, just announce your name and then go ahead with your question.
Yes, for me and say.
Fatmata, we're listening to you. Go ahead with your question.
Hello.
Yes, go ahead with your question, lady.
It's dangerous for a person. I want them to please help me how dangerous it is. Or how many hours can one use a face mask before removing it?
Okay, thank you very much, my lady Sisi, for that question about face mask. Lady Aminata, do you have another question?
Yeah. Oh, yes.
Yes, go ahead,
Okay.
my lady.
I want to ask about the studio. How should we protect the studio when we are having a studio guest?
Okay. How do you protect the studio when you have a studio guest? Okay, thank you very much for your question. Yes. Lady Aminata, go ahead. Go ahead, my lady. Just announce your name and ask your question.
All right. If there is nobody else, let me ask again.
Yes. Hello.
Go ahead.
Okay. I'm Mamusu Awatule from Bujo.
Yes, Mamusu, go ahead with your question. We're getting you loud and clear.
Clear. Okay. I really appreciate SLAWIJ and Mr. Jamiru and team for giving us this opportunity, because it's really not easy. Female journalists, we have been working so hard in the front line to kick out the COVID-19. And SLAWIJ activities has not been just in Freetown, but we appreciate them for bringing it down in the provinces. Some of us have been part of it, and they did so well while we were engaged, lactating mothers, pregnant women, to be visiting on the hospital. Even though we have the COVID-19, we kick away the fears from them, not to think as if even there is a COVID-19, you'll be injected in the hospital. I say thanks to them for that. My question here is, when someone ran away from a quarantine home, is it good for a journalist to announce your name, describe you and your address, and connect you to your family when describing you on air? That's my question.
Thank you very much, my lady Mamusu, for that question. I will give the mic to Lady Aminata. You wanted to ask one more question, and we throw it back to the professionals to answer. Lady Aminata.
Yes, Aminata again. You know, talking about the fight against COVID-19, we know it's something that has been of a very big challenge, more especially in Freetown municipality of the Western area. So for me, I want to know, how are they going to affect the bylaws? Because we've seen press releases that the use of face mask is mandatory, but when you go out to the streets, you're seeing something else. So how are they engaging the inhabitants of Freetown, more especially, to go by the rules and regulations in fighting this sick?
Thank you very much, Lady Aminata, for that question. Now we have 5 questions. Let me go over to you, Mr. Jamiru and Mr. Thomas, to answer these questions for us. You have the floor, Mr. Jamiru and Mr. Thomas.
Okay, thank you very much. I'll start with the one relating to the scenario that my sister just gave. Is it from Pujao, that when somebody runs away from a quarantine home, for example, whether or not a journalist has a right to disclose the person's personal information? I think the principle is established, and that is what we have been going by here at NACOVAC, that we try as best as possible to protect confidential information. So, for example, when we had the index case in Mo, and eventually the person passed away, the passing of the first community health officer, we refrained from disclosing that person's personal information. We also had a time when we lost a surgeon specialist at Cont Hospital. We refrained from disclosing personal information. The only time that I'm aware that perhaps we have made some disclosure was when we lost our dear friend and brother, Dr. Mikhail Bar, former minister, former head of department engineering from Leone. And that was because in the reasonable estimation of NACOVAC, the fact was already in the public domain. The news was out in the public domain, and journalists and others were reaching out for us to confirm the fact. And we had little room to maneuver, and we had to confirm that yes, he did not die from COVID, but his death was associated because when they did the swab after he passed on, the swab result turned out to be positive. So the principle is, whether in respect of deaths, whether in respect of persons at treatment centers or quarantine homes, we have to ensure that we maintain the confidentiality of information. But there are some things that people do. The moment you do those actions, they constitute a compromise of your right to confidential information. When, for example, you're supposed to be in a quarantine home, or you're supposed to be in a treatment center, like we had with case 90, and the public was asking us to put out the personal details and all of that, and we restrained ourselves. There are some actions when you do them, you have already waived your right to confidential information. So there may be no harm if that personal information is eventually announced, because we are announcing them in the interest of the public. Because if the public is not aware that somebody carrying a virus has gone into a certain community, if the public is not aware, that community is not aware, there may be the risk of further transmissions. So under such exceptional circumstances, but also that has to be based on consultation and advice, such a name, such a personal information can be put out. But that has to be the exception and not the rule. Because once you start doing it on one occasion and you do it on another occasion, if you are not careful, it might appear as if that is the practice or that is the norm. And that could give other people the right to be doing it as and when they choose to do so. So the principle is, let us respect the personal information of people, whether it's COVID death or COVID-related death or persons in quarantine home, wherever they are. Any eventual disclosure has to be done with reasonable advice, and it has to be the exception and not the rule. How to protect the studio when you have guests in the studio. I think that we have spoken about this in part. Initially, when for example, the Centers for Disease Control in USA, when they put out the advice, they said that the virus is capable of being transmitted on surfaces. Now, America CDC has revised that advice. They have reviewed it, and now they are saying that you are less likely to be infected through the surfaces. And sometimes you don't know where to sit when you have an initial advice and then you have a review of that advice. You don't know which one to trust. Because the new guideline that is coming is now saying to us that the virus, even if it is on the surface, it may only be there for a very short while. So whether it would be there for a short while or a longer period, we always advise people at intermittent stages, make sure you clean the surfaces with an alcohol-based ointment. Whether it's your microphone or the table surface or the chairs, make sure you use your disinfectants all the time. And when guests come to the studio, I see in some studios, for example, people could even take off their masks. If you have maintained social distance, for example, we are sitting this way, and I could stretch my hand, and there is still distance, you may say, okay, I may risk removing my mask because we are at reasonable distance. But if you find out that you have a studio and you don't have the luxury of space, and when you are interviewing somebody, you have such close proximity, make sure you wear your mask and make sure that the guest is also fully masked. The decision to relax your mask has to be based on reasonable distance between you and the person that you are interviewing. But make the wearing of mask the rule and not the exception. And make sure at intermittent stages, not only for your studios, but even in your office, in your room, in your house, in your parlor, wherever you are, once you have surfaces, or you have a handrail, or you have a wall where people could be touching at different times, as much as you can, those surfaces where you believe that you are more likely to be interacting with, because you don't know where the virus is placed. It's a respiratory complex. You don't see it come out. You don't see it drop anywhere. There are small particles that you cannot see, but if they are contacting different surfaces and different places, as much as you can, be using your disinfectants to disinfect those places, and the more we are less likely to interact with it. On the use of face masks, I think Harold is more of a specialist in that area, so I will let Harold speak about that.
Okay, thank you very much. For face mask, someone was asking whether
how long
it's dangerous and how long, how many hours can you use them. For face mask, it will depend on the type of face mask you are using. That is why it is not advisable for members of the public to use what we call the medical mask, the N95 mask. That mask is specifically made for health workers. It is so tightly fitted that no air will go in or come out. So the medical people will use this mask if they are going to do a procedure for 20 or 15 minutes, and then will remove and use the normal mask. So for the public, it's important for us to use the ordinary mask or the cloth face mask. That one you can use. It's very easy for you to use. But when you are alone, maybe in your office or in your house, you can relax the face mask, you can remove the face mask. Or if you are going for a walk, in an area where you are walking alone, you cannot use the face mask. But when you come across people in public spaces, in spaces like supermarkets, like public squares, it's important for you to use the face mask. Because the face mask is very, very protective. It protects you and others from droplets. Because coronavirus is a droplet disease. And these are heavy droplets that if you do not use a face mask, you stand the chance of infecting you. So with the ordinary mask, as long as you can. But for the N95, which is the medical mask, it is not advisable for you to use maybe more than 10 or 15 or 30 minutes. That is why you should not use that particular mask. But this ordinary one with 2 layers, they can actually protect you and protect others. And you can use when you are in a crowded area or an area where it's a public area. But if you are alone, you can remove the mask so that you get enough oxygen.
Thank you very much, Mr. Jamiru and Mr. Thomas. We'll take the last set of questions. Ladies, any questions? Please introduce yourself and then you ask your question. Thank you. The last set of questions, please.
Hello, Melissa, the Executive President for Cellular Association of Journalism. I may want today, help female journalists. Like I said, it's because we are having the Zoom meeting and you guys are presenting, but we have real situations that our ladies, encounter in the field. And I also have challenges like having the protective gears to go in the field. I don't know what strategy the NACOVAC is putting in place to support journalists in general and more for our constituents who are the field journalists to support them because they don't have some of these gears. And we know the community radios, they are not well equipped to provide these gears for their journalists. So I don't know what strategy are you putting in place. And I believe you need the media, and the media has a great role to play to support the dissemination of information around the coronavirus. And now that we are still having, dwindling figures, but still the corona is around, I think we want to know what strategy can you put in place to support the media to ensure that we're able to provide information, even in remote communities, without fear, as we have received knowledge how to protect ourselves when we're in the field.
Thank you very much, Madam EP. Any other questions, ladies?
Yeah.
Go ahead.
Yeah,
Go ahead. Yeah.
Yes. I may want to do this in Creole. Please permit me my EDN chair for the meeting.
You have all the right to go ahead in the local parlance. Nice to speak to you. Go ahead, my lady.
Hello?
Yes, you could go ahead. Feel free to say it in Creole.
Okay. We get issue here and there where my one gets the first int. Thinking of I'm where the fit on according to the DM. I'm where they can notice this lady na a victim COVID-19. It be not almost due to the date to the incubation period of 14 days. They are only 23rd, I believe, say the lady is COVID-19. And people them na my 91 begin looking to the time where let's get on Kaya and waiting at the gates. How get the case?
Oh, sorry, they were having such a bad network from our colleagues in the regions. But then let me go over to you, Mr. Jamiru. There's one, I would say it's a very impregnated question here from our executive president. If there's any support to journalists with protective gears.
Okay.
Let me go over to you, Mr. Jamiru and Thomas, because we're having a very bad network on reception from our colleagues in the region.
Recently, there was a study in Italy which suggested that COVID-19 patients may develop blood clotting complications. Somebody now took that study and gave it a twist, and that person started putting it out on social media that Italy has said that COVID-19 is not a virus, it is a bacterium, and it can be cured using antibiotics. Knowing fully well that COVID is a viral infection, and antibiotics do not cure viral infections, but only bacterial infections. So as journalists, once we get myths or misconceptions, let's investigate more so that we are prompt. We are prompt in putting out the right information. That is all I want to say, and I think that having this conversation with you has been very stimulating, and I think that people like you could become a critical mass in helping us to achieve behavioral change, not only amongst your women folks, but the entire country as a whole. Thank you.
Thank you very much, Mr. Jamiru. Let me go over to you, Mr. Harold Thomas. What will be your closing courtesies, please?
Yes, even with the request for the gears, protective gears, for journalists, I don't know, but what only we need is to just follow the rules. That is the hand hygiene, cough and sneeze etiquette, and also the face mask. Because as journalists, you do not need full personal protective equipment, except you are covering a story, you want to go into the red zone, which is not advisable at all times. But in areas where you want to do that, then the facility that you are doing the coverage will support you in actually doing that, and so that you can protect yourself. But however, we after this training, we will also get all the offline equipment, and then we can see how best we can support in areas where we can give you support. That is what I would want to say. And also, let us remember to protect ourselves. As journalists, it's important for you to protect yourself, and also to help to give sound and accurate information in helping others to protect themselves, like the public. So we should make sure that we get information, trusted sources, and then we will be able to give out this information so that we can also increase knowledge and also influence attitude. With this, I want to thank you very much, and I will just advise all of us to stay safe according to the rules, and then we get information from trusted sources so that we'll be able to give information to people so that we enable them to take decisions in solving problems relating to their own health. Thank you very much.
Thank you very much, Mr. Jamiru, and thank you very much, Mr. Harold Thomas. Our trainers have been Mr. Solomon Jamiru, he is the spokesperson for the EOC, and Mr. Harold Thomas is the risk communication lead. But I'm not worthy to wear the shoes of the person who is going to give the vote of thanks. Let me go over to you, my lady Martha Cargo, my eminent lady, to say thank you to these people who have enlightened us in today's training. Martha Cargo, my lady, are you there?
Sorry, water. Thank you very much, Commissioner, for hosting this session today. I learned a lot, especially from the presentations and the questions asked by Mrs. Masako. The sessions were very good today. Thank you so much, and thank you very much to everybody who participated, the presenters, as well as those who asked questions. Thank you so much. Thank you so much.
And thanks to our trainers. Thank you very much, ladies. Let me hand over you to the EP for her final compliment, and then we'll bring this curtain down in today's edition. Madam Executive Producer, I am Patricia Ganda. I hand over to you.
Thank you so very much, Lady P, for hosting this meeting. I am so grateful to the National COVID-19 Response Emergency Response Center, Mr. Jamiru and Mr. Thomas. We are so grateful as SLAWIJ, the Association of Women in Journalism. We are looking forward to working with you, and we have made notes of key issues we learned here today, and also looking forward to how we can partner to help us with our roles as journalists in the front. Let me promise you that we have already started reporting on the virus with credible information that we have history of information and that of the Ministry of Health. We'll continue to do that, and we look forward to reaching out with to our female journalists in the provinces with more information. And again, I'll go over the protection gears because their radio stations cannot provide them all of that. But I'm sure we'll continue the conversation outside this meeting. But we are very grateful at SLAWIJ